Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady. And today's episode was actually an episode that was, we've discussed this concept many, many times, but one of my patients who's joined us today, Amanda, most recently brought it to my attention that perhaps this needed its own show, and that perhaps that even though we've dabbled and talked and danced around it, we really need to bring it to center. And the show is really about closure. Closure meaning, how do we close surgical incisions? And more importantly, how does that impact? Obviously people get cosmetic surgery, plastic surgery, and the number one thing I hear is, do you do that scarless surgery? Do you close without scars? So obviously scars are a massive part of what patients are trying to avoid or maximize. And there is absolutely no doubt that there are ways to make it better and ways to make it worse. So, welcome to the show, Amanda. Thank you for giving a shit and saying, hey, I think this is an important topic. And two, for being willing to come on the show, because I do think the shows are more interesting for listeners when we have the perspective of patients, because at the end of the day, obviously, I haven't had surgery. I just do the surgery. So you recently had surgery with us and you're a nurse. So tell me, let's begin by telling us who you are and your background.
Okay. I'm Amanda, and I am a mom of two kids, an 8-year-old and a 4-year-old. Prior to that, I was a nurse. I have my bachelor's in nursing. I graduated in 2009. I have my master's in nursing education, graduated with that in 2014. So, I really like the education piece of it. And I think that there's always room for more education. And I've worked in trauma, vascular, cardiology, outpatient oncology. I've done a little bit of everything. So I know a little bit about what I'm talking about. So I think from a mom perspective, a nurse perspective, and a patient perspective, I can provide a lot of insight.
Yeah, and I think it's really important, because one of the things that we were talking about is that maybe some of the things that you understand as a nurse and I understand as a physician may be different than a mom or a dentist, maybe not so much a dentist, but maybe a mom who's an accountant or perhaps whatever the case. So a medical background gives you a little bit more of a discernibility. You just recently sort of semi-graduated. Could you share with us what procedure you had and when you had it?
Absolutely. So I had a complete mommy makeover on February 10th. I had a tummy tuck with liposuction. I had a breast lift with a reduction and implants.
Okay, amazing. So, and you're right, 8 weeks, 7 weeks? How far out are you now?
I'm 6.
6. Okay, great. So why this is relevant is that you are right now in the eye of the hurricane. What that means is in regards to your outcome, and we're going to be very focused on this episode and talk about incisions, scars. You have a lot of them. You have what's called an anchor. An anchor is the incision on your breast. That means that the incision on your breast goes around the areola, that's the pigmented part, down the breast, and then in the fold. And you have that twice on 2 breasts. And then you have an abdominoplasty incision, which is essentially hip to hip, and an incision around your belly button. So it's safe to say that your body right now is in the midst of the hurricane of healing. And it's safe to say that in terms of looking at yourself, you got a pretty good idea of what direction you're going, correct?
Yes, that's correct.
Okay, so what you said to me in clinic not too long ago, what was it that you said to me that I always ask patients, hey, are there any topics that you think are important, especially since you're in the midst of this journey? And what did you tell me you thought was something that perhaps people are not maybe noticing as much or gravitating too much or don't know as much about?
Well, I think the biggest thing about plastic surgery is your overall outcome. And part of that overall outcome is, what are your scars going to look like? And, I've heard you say in your podcast before that the scar creams are kind of bullshit, whatever they can be. But most of it is, your surgeon and how your surgeon closes up your incisions. And I believe that my incisions look flawless because you took the time, you yourself took the time and stitched them up beautifully, which most surgeons don't do that. But then again, most surgeons are performing surgeries that are not elective, which is like, repair my knee, get me in, get me out, whatever. But my incisions, like, I want them to look good. I want to wear a bikini. I don't want people to see them. I want to look good naked in front of my husband and, not worry about these crazy scars. And part of that is closing the incision because, if I'm suturing something as opposed to you suturing something, we're going to have two different outcomes, whether it's a scarf or, a body part, whatever, just like the technique that we have. Whereas if you did both of them, yours are probably going to look identical. And you're going to take the time to make them look perfect. Whereas me, I'm an amateur, and it's not going to look good. So having a surgeon that does the closure and takes his time is well worth it, in my opinion.
Okay, well, you hit it right on the head. And we've talked about it a number of times, and I tell it in every single consult. So let's just break it down to the basics. I think some people listening are like, yeah, right on. I follow Dr. Vaughn. I've heard this part said before. And I think some people are like, what? What do you mean he needs to close it? Of course he's going to close it. Who the hell would close it? So there is absolutely going to be a subset of people that are going to be like, well, what alternative are there? And it turns out there's a massive variety of individuals who will actually close you. That's correct. You go and get a plastic surgery procedure done by Dr. Schmo, and Dr. Schmo may or may not, and definitely in most instances may not, be the one that is actually closing you. And that is such a wake-up call for some people. They're like, how is that possible? So let's begin at the basics. Mm-hmm. When we talk about an incision, I actually am in the process of writing a lecture for a bunch of neurosurgeons. As many people know, my wife has suffered from spine surgeries and spinal issues. She's had 6 spine surgeries, and I've now become intimately friendly with many spine surgeons, some of the top spine surgeons in Cedars, and they've asked me to do a ground round and come and speak to all the spine surgeons because yet, despite the fact that they're doing spine surgery and potentially saving your life, patients are unhappy with the outcomes, and scars matter, even if you're having spine surgery. So closure is so, so important. And as I was throwing everything together, I kind of broke down scars into a couple of concepts so we understand. First of all, it has to do with how you get into the wound. So when you make an incision, okay, breast lift, tummy tuck, most surgeons will cut with a blade, and then use the cautery, which is heat, to go through the rest of it. And essentially what you're doing is if you use heat to get through the top layers, the skin and the dermis, you will fry the shit out of the skin. You will burn it. It's microscopic thermal injury. What do we know about your fingers and your arms and your face that get burned? They heal like shit because it's a thermal injury. And so right out of the gate, you're behind the 8 ball. If your surgeon is lazy about opening the incision, goes through the skin with the blade, and then blazes through with cautery, why would he do that? It's because it doesn't bleed. So they don't want to see blood there. So it's easy, it's clean. What do? I use a blade through the skin and a blade through the dermis. Those are the parts that lead to your visible scar. And what I do is I have to pre-inject with epinephrine so that I don't get a tremendous amount of bleeding. That is time consuming. So right out of the gate, you're going to be screwed. Because if your surgeon blows through there with cautery, even if he or she closes you, even if he or she does an immaculate job, the skin is already burnt and more inflamed and will make a thicker, darker raised scar. So that's very, very important. The thing that people don't understand is at the end of the day, they're always asking me, what is your wound care protocol? AKA, what are we going to do about my scars after I heal? What creams, lotions, potions, machines, lasers do you have? None of that shit works. None of that shit makes a difference. If it did, we would not need this podcast. If there was a device, a cream, a tape, a procedure that alleviated, eliminated, or reduced scars sufficiently, every surgeon would use it. The spine surgeon would use it. Your plastic surgeon would use it. Your OBGYN would. Why the hell wouldn't we use it? we have proven, like chemotherapy, like diabetic medication, that when I use this, that, the other, your scar is 37% better. There isn't. That's why everybody comes up with their own concoction, because nothing has been proven. I assure you, unlike rare diseases that the pharmaceutical companies have no desire to put money behind, there is a trillion-dollar business in scars. So I promise you, the fact that we don't have a magic wand is not from a lack of trying. Many companies spend billions of dollars trying to find the holy grail. So the question then is, okay, what the hell makes a difference? There are two parts that make up this equation. There is you and there is me. Right? There is you. You being what? Who are you? What is your DNA? How will you heal? Will you make a brown scar? A red scar? A white scar? A thin scar? A thick scar? Will it be flat? Will it be raised? That's who you are built. There are people, very rare, who when you operate on them, their body gets super pissed and makes nasty, thick scars. Everyone loves the word keloid. It is incredibly rare. It is very rare. It's very rare that your body is so against healing that it creates a keloid. But we hear the word used all day long, and all it's being used is used to explain, oh, I operated on you, Amanda, and your scars look like shit. And so I'm going to say, you know what, Amanda? You unfortunately make keloids. And you'll say, that sucks. All the while you're thinking to yourself, I got an appendix removed when I was a kid and I didn't get a keloid. Somehow, magically, now you have keloids. So there's that component, and then the other half. And the other half is exactly what you said to me, which is, what did you say to me? You said to me that at the end of the day, the closure matters. Closure being what? Who on earth is closing you? How are they closing you? What type of sutures are they using? How many layers, right?
Yeah.
All those little details matter. And it turns out that in most of the instances, as you alluded to, which I've mentioned on numerous occasions, but we need to really hit it home, is your surgeon, the one you paid, the one that you love, the one who you adore, the one who lets you put you to sleep, that person is not, again, I repeat, is not closing you.
And I think that's a big misconception.
And I think that's a huge shocker, right?
Mm-hmm, yeah. I mean, there's at least probably probably not your surgical suite, but like 10 people, like circulators, nurses, anesthesia. I mean, there's a lot of people. I mean, you can't, you're asleep. You assume physician or your surgeon is, closing you up, but that's 99.9% of the time, that's not the case.
All right. So it takes a nurse to kind of know that because you're in the world, and it wouldn't shock you if a CRNA was doing anesthesia. It wouldn't shock you if a PA walked in the room. It wouldn't shock you because in medicine, there are many, many types of individuals in the case. So the analogy that I use to most patients are as follows. If you hire the most badass, and I mean badass law firm, who is really going to be doing your legal case? The paralegals. That's who does your case. That's why when you look at the bill, it's divided into the primary and the paralegals billing. When you go to an amazing accounting firm, who does your accounting? The bookkeeper. The bookkeeper does your accounting. The accountant just double checks it and sends it into the government. Mm-hmm. When you go to a dental practice, who does a lot of the work? The hygienist. So it should absolutely not shock you, surprise you, or make you feel awkward that when you go to sleep, when it comes to closing an entire anchor on one breast and an anchor on the other breast and an entire tummy tuck, which is 1 billion sutures, there's some other a-hole who's closing you.
And
who is that other person? So that other person can be as high up as another surgeon you've never met, a junior, a partner. I remember when I first graduated and I didn't have a lot of business and I wasn't busy. I remember senior, older doctors hiring me to come and close for them because they were tired and didn't want to close. Yep. I never met the patient. I never said hi. It was in the consent that an assistant was present, and the patient assumed that I was just there to hold retractors. So it could be as high as a surgeon, then it can be a PA, what's a PA? Physician's assistant. Then it can be a nurse, and then it can be a tech. A tech's not even allowed to close. In my facility, in my operating arena, there is a tech who closes for the majority of the doctors besides me, almost all of them. Mm-hmm. He's not supposed to even close. He's not even allowed. At least the nurse and the PA is allowed to close. So this is a major wake up and a major news flash. You have to look your surgeon dead in the eyeballs, look at their eyeballs and say, are you closing everything? Meaning you are there from the beginning to the last stitch. And I bet you majority will hesitate, will stutter. Well, I mean, I'm there for most of it, the parts that are important. But in plastic surgery, everything about the closure is important. I mean, I'm talking about the last goddamn layer is important.
Yeah.
And so when you look at your scar, although I cannot guarantee you that your scar will be outstanding, I can tell you that in terms of the 50% we control, we don't control your DNA. We can't change it. You're who you are. Mm-hmm. But we can control closure. We can close it shitty. We can close it well. We can close it with big stitch, low stitch, burn the skin. We can do a lot of things. No one will close you better than me. No one. So we know that we can't guarantee it to be good, but we can certainly take that dial and crank it to 10.
Right.
Right? 10 being badass maximum. And we should, and we ought to, and we do get very good to incredible scars consistent. So your scars at 6 weeks look nothing shy of effing amazing, right? And they're thin, they're flat, they're narrow, and they're light.
Correct.
And while you haven't fully healed, we still have a year, 18 months to go. We're absolutely ahead in the race. We're absolutely on the right track to having an outstanding scar, right? And that is where you want to be. If you come out of surgery and your scars were all jaggedy and they're all lumpy bumpy and your surgeon keeps telling you it's going to be fine, it's normal, it's going to get better, you're pretty much behind the 8 ball, because that means that the edges are all weird, they're all jaggedy, and it's going to take a lot for your body to overcome that, and it does that through scarring, right? And I think that's really, 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 really important. You know what we're going to do is we're going to take a quick break, and then what we'll do is we'll come back, and I'm going to try to explain to you what is the magic sauce, right? Is it just that I'm like a wizard or so I have some special powers? No, I'm just incredibly diligent, and I hate having to close. It is not fun. It's a pain in the ass, but it's my job. And I'm going to tell you all the little details when we come back. All right, let's take a quick break, and we'll be back to the second half of Plastic Surgery Uncensored. Welcome to the second half of Plastic Surgery Uncensored. It's Dr. Rady and my lovely RN patient Amanda. We're chatting everything you need to know about closure, scars, and optimizing your outcome, because if you go get a mommy makeover or a facelift and your scars look horrible, you will not feel liberated. You will not be confident. You will not have exchanged one insecurity now for another one. So people always ask, oh, well, what do you do? There's no magic. There is no magic to losing weight. There's no magic to getting in shape. There's no magic to being successful. There's no magic to anything, because it's always the long and painful road. So what it is it takes me hours to close your wounds. And absolutely, I want to let somebody else close. I would love nothing more than to do, at the very least, just your right breast and let George do your left breast. But
I'm not going to be happy. I'm not going to be as happy with George's suturing. I can tell you that.
Right. But fair enough. You didn't pay for George's suturing, did you?
I did not.
You paid a lot of money, and I said, I'll take care of you. Now, I don't have a problem if patients are told that other people will close them. They're informed, the patient understands, and the patient is aware, All right, that's your prerogative. Okay, no problem. It happens in orthopedics. I am certain my wife's spine incisions were closed by somebody other than the spine surgeon. But I didn't give a shit, nor did she, because we were worried about the spine. But I assure you, if she went in for a mommy makeover or a facelift or nose job or whatever, she would give a shit. Right?
Yeah. And you alluded to this on one of your other podcasts about if you pay more, you don't necessarily get more, but if you pay less, you absolutely get less. And I think that that's part of that, part of that is like, or not me, but somebody is not paying to have, the time taken on the closure and to have that beautiful scar. Cause
right. Very, very true. So what are the things? So what it is layer by layer rather than let's say it's 4 layers. I could close you in 2 layers. I just take bigger stitches, bigger whopping holes. Then instead of, let's say I can put 100 sutures, I put 50 sutures. And then instead of closing the last layer, I just close the bottom mid 2 layers. In other words, it's a difference between having 800 thread count versus having 200 thread count. It's just more of the right thing. And every layer takes time. And time is money. And the incentive is, let's get the hell out of here. 1, it's tiring. 2, I have to pay the anesthesiologist. 3, I have to pay the operating room. 4, I have to pay the staff. So I have a massive incentive to get done as fast as possible. I can do another case, perhaps. So the closure, there is no magic. It's just sheer, unadulterated discipline. And the truth of the matter is that all surgeons can get significantly better outcomes if they wanted to. Now, if you go and you pay very little for your mommy makeover, you should not be surprised that your scars are not being closed super diligently. You just shouldn't. The guy's not going to do it. Now, if you spend top dollar, you should expect it, you should demand it, you should inquire about it. And there are many people who are like, this is not within my budget. It's good enough. I'm happy. High five. And then there's a lot of people who are like, I'm saving, as did you. Mm-hmm. And I'm going to try to find the quote unquote top surgeon. And with that comes top quality. And that means you got to close. I gave you the money. You got to ask your surgeon. You got to point blank in his face, ask him, will you put every damn stitch in? Will you be there to the end?
Yes.
Very simple.
That is the question. And I think, if you can ask a surgeon any questions, I think that needs to be one, if not the most important question on your list, because we're getting this procedure because we want to look better. And part of that looking better is having a beautiful scar.
100%. You couldn't have said it better. At the end of the day, women who have babies successfully and healthy, people who fix their orthopedic broken bones without issues, spine surgery, almost always complain about their scars, despite a successful surgery, because we are humans and we don't want to look at some ugly, thick, gnarly scar, no less on a cosmetic procedure. So you are absolutely right. Do not assume, do not take it for granted. That's why we did the show, because you were right. You're like, I don't think people really understand that when they go to sleep, somebody else is doing this. Even though you mentioned it, we should do a dedicated show. Last but not least, what are your post-op care, Dr. Vaughn? Okay, well, what do I do to fix it? Do you think lasers work? No. Do you think there's special creams that work? No. Do you think, no, none of it works. If your DNA is shit and I do a horrible job or someone else closes you and you have a terrible outcome, those other modalities are not going to help. Where do they come in is to take something that's really good and make it really, really good. They're 5%. All I use is paper tape.
Yep.
Paper tape. Mm-hmm. It's a $5 roll of 3M porous paper tape. Did you hear that? I don't use anything else. No silicone sheets, no special lasers, no nothing. What are you using on your scar currently, Amanda?
I am using the tape, and on my regimen, I use the tape for 4 days. I take the tape off, and then I use either the Aquaphor to rehydrate the incision, or I have just now graduated to the Biocornium, which is the only FDA-approved silicone scar treatment.
Right.
But, other than that, I'm using the tape.
Yeah. So 97% of your post-care is paper tape.
Yes.
Most patients, we end up using just Aquaphor, which is like Vaseline. And then if they beg and beg and beg and they want to throw the kitchen sink at it, we'll give them the highest quality liquid silicone just to rub on there and then makes them feel good. And I say, why not? It's like $80. Who gives a shit? But you don't see me giving you this huge post-surgical wound care package where I charge you an additional $2,000 to come in for 6 months and laser you and high beam you and acupuncture you and needle you and Morpheus you. And I don't do any of that.
No.
Because it's not necessary. It's all in the closure.
And then
at the end of the day, what's that?
So they look beautiful. They look absolutely stunning.
Well, I appreciate that. And at the end of the day, there is no shortcut to anything worth having in life. And if it's too good to be true, it ain't true. Mm-hmm. That's just, so I love these phrases. If you pay a lot, you don't necessarily get a lot. You pay a little, you absolutely get a little. Mm-hmm. If it sounds too good to be true, it is absolutely not true. And if your mommy makeover, anchor reduction, breast augmentation, tummy tuck, lipo is done in 4.5 hours, there's something wrong. Somebody is cutting some corners, I assure you. You cannot make a phenomenal souffle in 8 minutes. It just doesn't happen. At any rate, thank you so much for prompting me to have my rehash this, and secondly, for coming on. And, you know, I always think any patient who comes on and exposes themselves is courageous. You know, a lot of people are, I want to be anonymity, but the reality is by you coming on and having this conversation, you know, people are going to learn something, and it makes it much more valuable if it comes through your mouth than through my mouth. Any last minute advice as a patient, a mother, and a nurse do you have for patients in preparation for, say, a mommy makeover?
I mean, I think you owe it to yourself to, if you can't afford it, save money until you can afford it, and just do your due diligence. I mean, you have one body. And I mean, you need to really just make sure that you look at what you're getting and make sure that you're happy with what you're getting. I wish I would have done this. I would have done it 10 times over. I mean, it's amazing. I look amazing. I feel amazing. And I don't know. I can't say enough wonderful things about your practice and the guidance that they've given me, and, you know, a new outlook on my new body. I'm thankful for that.
Well, we are honored, right? It's a huge responsibility. You come in, your mom, your wife, we have this opportunity to do it right or do it wrong. And we take that as a collective group in the practice super, super seriously. And it's an awesome feeling to know that you are happy and bettered as a result of something that we've done for you.
And being a nurse, you know, I've seen it all. I've seen good, bad, ugly, bad stuff. And I mean, I'm not just going to like go knock on Joe Schmo's door to do surgery. Like, I did my research, and, you know, you're the shit.
Well, we love you. Thank God I'm the shit and not shit. It's all about the little things. At any rate, guys, I really hope you enjoyed this show as I did. Couple things. Number one, please, if you dig the show, we would love for you to share it with those people that you think might find it interesting or cool. The show exists purely because of you guys listening. The more people listen, the more energy we get to go. 2, if you like the show, say something nice. Go write something nice. Those things really make the whole team feel good. If you don't like the show, well, don't write anything. Okay. All right. Until next time, we look forward to having you on the show. Plastic Surgery Uncensored. I'm your host, Dr. Rady, signing off.